Good afternoon, everybody, and welcome. We're thrilled to have so many people joining us today for this important conversation. As most of you are likely aware, our health system's labor shortages have reached a crisis level. And for example, the Health Collaborative's most recent workforce report showed an alarming 81% increase in the vacancy rate for registered nurses in our regional hospital systems just last year. 81% increase. My name is Hope Arthur, and I'm the Director of Workforce Innovation at the Health Collaborative in Greater Cincinnati. I have the honor of leading our work in healthcare workforce innovations and convening our members and partners to increase the size, diversity, and preparedness of our region's healthcare talent pipeline. Next slide. We're joined today by the Health Collaborative's member, EY, to get after solutions to the Great Resignation. Let me introduce today's presenters. First, we have Rosalind Feinsod, Principal of People Advisory Services at EY. Rosalind specializes in workforce planning, human capital strategy, and benefit design plans. We also have Kendall Pollander, who is Senior Manager of Consulting. Kendall focuses on innovation and strategy in the health and wellness industry. Mark Fryer is the Senior Manager of Consulting. Formerly a clinician in one of our regional health systems, Mark specializes in crafting strategies and operational solutions for healthcare systems. And Brian Mills, Manager of Consulting. Brian is a clinical nurse consultant specializing in providing strategy and leadership in healthcare. Last but not least, we're joined by Jason Bubenhofer, who's a member of the Health Collaborative's Workforce Innovation team. He specializes in business intelligence at the Health Collaborative, where he gathers and analyzes data and insights from across our region, then packages and disseminates meaningful information back out to our members. Let's talk about what we're going to cover today. To better understand the crisis, we're going to share both regional and national data. We'll discuss immediate, short-term, and long-term strategies for addressing this challenge. And we'll talk about emerging technology and analytics that might be useful in managing talent. Next slide. The Great Resignation in healthcare has been years in the making, but with COVID and the stress and burnout it added, it has accelerated tremendously. Many healthcare workers left the industry during the pandemic to escape the harsh conditions and growing responsibilities. And with each worker that left, it meant another worker had to pick up that slack. Burnout became synonymous with hospital worker, whether that worker was a nurse aide, or an environmental services employee. And as you'll hear today, the challenges of the Great Resignation go far beyond clinical staff. With alarming trends in turnover, including first-year turnover, it's become evident that no employer is going to hire themselves out of the resulting workforce shortages. Success is going to take many, many different strategies. This includes focusing on attraction, onboarding, retention, and advancement opportunities for employees to ensure progress. And to identify and create impactful solutions, employers will need to include the voice of their employees in creating them. And it's also going to take changing the systems that help students find their ways into health careers. A perfect example is the recent approval for Cincinnati State to be able to offer the Bachelor Nursing program. This change will help our region increase its capacity to prepare more nurses, which is hugely needed. But it's just one of many system changes that need to be addressed as well. So without further ado, let me turn this presentation over to Jason Bubenhofer, and he will share some of our regional data insights. Jason?
Thank you, Hope, and thank you to all who have joined us this afternoon. Here at the Health Collaborative, we have collected regional workforce data on behalf of our major health systems for more than 15 years. And right now, I just want to provide a very brief, high-level overview to illustrate some of the challenges that we're currently facing in our region. This first slide here shows overall vacancy rates for all workers in our participating health systems, ranging from the C-suite all the way down to our entry-level workforce. We have data going back to 2007, and for the better part of the last 15 years, our total vacancy rate hovered in a narrow range of roughly 4 to 6%. Last year in 2021, however, our total vacancy rate spiked all the way up to 10.5%. And this is by far the highest rate we've seen since 2007. Among our surveyed health systems, this actually represents more than 5,800 open healthcare positions in our region. Lauren, go ahead for the next slide, please. As we drill down into individual job titles, we see a broad range of shortages across the spectrum and impacting more than 24 individual jobs. We typically survey about 60 individual job titles for our participating health systems. And this year we had 28 individual job titles with vacancy rates greater than 8%. 21 of those job titles actually had vacancy rates greater than 10%. I won't be reading these individual jobs off, but you can just see on the chart some of these titles with the highest vacancy rates in our region. To help put this in perspective, in a typical year prior to the pandemic, we might have only 2 or 3 jobs with vacancy rates exceeding 10%, whereas now we have a broad range of jobs facing acute shortages in our region. Next slide, Lauren. Here's a much longer trend showing our local nursing vacancy rates, and this actually goes back more than 30 years, all the way back to 1990. You might first notice that in the late 1990s and early 2000s, our region was faced with a highly critical nursing shortage that took more than 5 years to resolve itself. And now in 2021, our 13.7% nursing vacancy rate is the highest vacancy rate among nurses in our region since at least 2004. I will point out that prior to the pandemic, our nursing vacancy rates had been slowly inching higher most years, but this biggest vacancy spike has occurred within the last 12 to 18 months. Next slide, Lauren. Finally, I wanted to share a slide on our local healthcare retirement rates. Anecdotally, we've heard that more folks have recently retired out of the healthcare workforce, and our data shows a little bit of a retirement increase. Retirement rates inched up to 1.6% in 2021, and this matches 2018 as the highest rate we've seen in the last decade. That said, while the retirement rates are slightly higher, the impact on our workforce is likely marginal, as we haven't yet seen a dramatic spike upward in retirements, at least in our data. The average retirement age for a healthcare worker last year was 64.9 years old, and it's down slightly from 65.1 years old in 2020. Now that's all for the data that I have today. So I'm going to turn it back over to Hope Arthur, and she can help introduce our partners at EY for our feature presentation this afternoon.
Thank you, Jason. I appreciate that. And I appreciate you taking time to share some grounding on our regional data. Mark, let me go ahead and just turn it right over to you.
Thank you very much. Thank you, Jason. That was very, very informative. And we're going to talk a little bit more about some of those statistics, as well as what we're seeing nationally, and have I really hope to have a dynamic conversation around what you could be thinking of, more an immediate resolution, maybe more short term and then long term, to help kind of mitigate some of these challenges and reduce the impact it's having on your staff and your facilities. One thing we did want to start with, though, is a polling question, just to help us better understand what you're all facing, and then we could kind of direct some of the discussion towards those areas. So you should see a polling question pop up, and you can just answer those. And once we see a good handful of folks answering, we'll end the poll and proceed. Yeah. So obviously some finance problems, and burnout, not surprising there. Okay, it's a few more minutes or a few more seconds here. Okay. Good. So, largely the group is experiencing more of this increase in burnout and turnover, and then overall employee morale, which is pretty consistent. And we've done this presentation before with with a group of nearly 600 individuals, it came out right about the same, about 56% really facing that burnout, and then the remainder being in the financial area. Thank you for that poll there, and we can go ahead and proceed. We're going to have a few other polls throughout the presentation, so just be on the lookout for those, and we'll see how everyone's feeling. So when we look at the situation we're all facing here, we really look at it from a supply and demand perspective. From the demand side, as we talked about, there's, by 2030, there's going to be about 80 million adults that are going to be over the age of 65, which obviously is going to drive demand and for that kind of elderly care, geriatric care and services. But that didn't change, right? That didn't change when the pandemic happened. That we were already on that trajectory. And then to kind of add to the challenge from a supply side is we have more people who are going to be retiring in the next 5 to 10 years. So what Jason was showing us was not a large uptick, but as we continue to age, we're going to see more and more people reaching those retirement age, and it's going to cause another, more of a shortage. Now, assuming that demand doesn't significantly increase, we don't have another pandemic, we don't have another kind of wave, just alone without additional external variables, we're already facing a challenging time. And then on top of that, we have the schools that, though have had some modest growth, and maybe even about 5 to 6% of growth in terms of degrees, there's still a number of people who are qualified who are not able to get into those schools. And so we see there's opportunities for organizations to tap into that supply and figure out ways we can get them into the clinical settings. And it's, you can't really go without saying it. A lot of you said it in the survey, the polling question. The stress and dissatisfaction of working through the times we've gone through over the last few years has really taken a toll on everybody. And because of that participation, we have nurses who are very discouraged, and we are going to continue to see challenges with recruiting, retention, and of course, then on top of that, as the polling questions suggest, more wages are going to go up, which is, hey, it's great that everyone gets paid more. The challenge is when organizations are not financially able to sustain that level of financial impact, it becomes more problematic for everyone in the area and within the organization. So we need to definitely keep an eye on that. Let's go to the next slide. Some of the surveys we found through some of the larger national nursing recruiting organizations have found that we're seeing a number of about 35% of the nurses surveyed are considering leaving the workforce, leaving healthcare altogether. So we see about of those leaving, 35% leaving the clinic, and then of that, some are going to get out of healthcare, and others are going to pursue things outside of healthcare. These are going to just continue to add to the demand and supply problems. And the biggest thing we're seeing is a lot of clinicians are leaving healthcare and going into non-traditional areas of the economy. We're seeing capacity in nursing programs continuing to struggle. We're seeing younger nurses, as Hope mentioned, retention of the first year, second year nursing students or staff are challenged by themselves, and they're not interested in a lot of this long hours and challenging schedules. And the pandemic on top of that has really caused more of a problem. And because of that, we're seeing incentives being placed on recruiting, and those are just unsustainable, as we mentioned, from a financial perspective. So it's really kind of the perfect storm. We've all been going through it. You're all on the front lines, you know it. But what I like to do then is kind of, well, I think we'll have one more survey question, and then we're going to talk to the rest of our team here to go through some of those immediate, short-term, and then longer-term options for consideration. And I'm hoping a lot of you will see things you're already doing, but maybe you'll also take away a few things for future use. Kendall, over to you.
Thanks, Mark. I think we're going to launch this second polling question here. So before we dive into some of the specifics that Mark was just talking about, just want to have an understanding of where you're seeing the biggest retention issues. And this is single choice here, so just select one. Looks like a lot on the nursing side, some unlicensed clinical staff, probably an even split there, and then a couple on the physician side. Just give it maybe a couple, 30 seconds more. We've got a couple that are still getting their answers in. Pretty even split there between the nurses and the unlicensed clinical staff. All right, we hit just about a minute for the polling question. I think we've shared results now. That's just helpful for us as we're thinking about, the next couple of conversations that we're going to go into around mitigating these. All right, so if we want to move into the next slide. Thank you. So we're going to spend a little bit of time, as Mark mentioned, talking about the immediate, near-term, and long-term solutions or ways to address some of the challenges. But before we get there, just want to spend a little bit of time thinking about the challenges, the frustrations, and the pain points from the clinician's point of view. So going to go through the 6 that you see here, which is really from our conversations, our research, kind of the 6 overarching that we've heard. And I'll say that there's quite a good amount of overlap between these 6. So they're not individual, it's kind of a combination across these different factors that's really leading to the acceleration of this staffing crisis. So first and foremost, I think, we've kind of touched on this previously, but the satisfaction and burnout, especially from COVID and that first year of COVID, has really increased recently and continues to increase. And that's driving a lot of clinicians to leave healthcare overall, as Mark just shared on the previous slide. When we think about the second one here, onboarding, sometimes it's easy to think onboarding is just one piece of an experience, but really when you think about that as the first experience that clinicians have with the health system, when it's a negative experience or there's not enough information that's shared or it's difficult to navigate, it really sets the stage for clinicians moving forward and how long they're looking to stay with an organization. We've seen that 20% of those clinicians that are hired are not expecting to stay longer than 12 months with an organization. And onboarding can really increase that number if it's a poor experience. When we think about benefits and incentives, this is really around the fact that those have been structured to work in the system of yesterday, and we're not really tailoring them or updating them to work within the systems of today and tomorrow. So they're dated in how we've structured them. The communication and peer-to-peer support, clinicians are really feeling quite isolated these days. There's not a lot of support network that's structured for them to be able to connect across peers or to have that open line of communication and feel heard. That's been a challenge that's been ongoing. The last 2 here, the growth and education opportunities, really understanding what career paths look like and being able to understand how you might grow with an organization. The 20% that aren't expecting to stay longer than 12 months that we touched on is really driven in some ways because they don't see what the next step is. So they're looking outside of an organization for that growth and for that support from an education perspective. And finally, a really increasing trend is the shift from ability to really focus on patient care into administrative burdens. So not being able to do the things that you've trained to do and that you're really passionate about, instead being weighed down by all of the administrative tasks, which is further leading to that burnout that we talked about in the first one. Would love to know if you want to add in the chat any others that you're seeing, but we'll kind of keep moving forward here into the ways to look at addressing some of these. So with those in mind, we're going to spend some time going through actions that can be taken from an immediate perspective to really mitigate what's happening right now, from a near-term perspective to help stabilize organizations, and then that longer-term perspective in terms of how do we think about sustainability and growing once we've gotten to that stabilization. So starting with the immediate, we'll go to the next slide. We'll just talk through how we think about these against those 6 kind of buckets of pain points that we touched on previously. So first and foremost, when we think about that satisfaction and burnout, some of the immediate challenges that can be addressed would be things like offering and providing resiliency training. And what we have found is that having that type of training that teaches clinicians tools for how to manage their daily schedule and how to manage stress actually has quite an impact on the kind of burnout feelings and the ability to say no and focus on the things that matter. The other thing I'd call out here is clinician listening sessions. So really allowing for our clinicians to feel heard and to feel that they have a voice, and to be able to communicate and know that there are actions being taken. That goes a long way. That's across the board, not just clinicians, but it's really key that you have an outlet and a way that you can voice your frustrations and feel that things are being actioned. The onboarding process, as we talked about, really starting day one of someone being hired successfully. So the things you can do in the immediate term is really looking at setting up a peer advisor program, making sure that you're starting to build that network for anyone that you're hiring right away so that they have someone they can go to with questions. If something is a difficult or confusing process, they have a way to move forward with it and start to feel connected to the organization that they're hired into. And that also includes making sure they feel a support beyond their department, being able to have that interdepartmental connections. From an incentive perspective, really looking at how do we first and foremost think about retention bonuses for our employees that have stayed so that we don't lose any of those that know the system really well, but also starting to think about how could we change and adapt our incentives to be more flexible and more tailored to drive different behaviors so that we are seeing more of that retention and we're keeping up with the way that our systems are structured today. We go into the next slide and getting into that peer-to-peer support. So again, back to the onboarding, really starting day one by creating that support network for our clinicians when they come in the door, but then also coupling that with the ability to provide communication channels. So how do they communicate with each other? Are you enabling that? Do you have multiple channels that they connect with or different groups they can be part of? And how are you cultivating that culture of transparency and openness so that they feel like they've got the support that they need? When we think about the growth opportunities, it's kind of twofold here. It's really thinking on one hand about what other working capabilities might we provide. So could we start offering more remote work in addition to the in-person? And the other side of this is thinking about creating those career paths. So showing clinicians how they might be able to grow within the career so they don't have to leave after that 12-month mark. And finally, this kind of overarching one around focusing back on patient care, understanding from listening sessions, what does it look like for our clinicians, our frontline staff? And what's really critical and really helpful here is starting to do day in the life of. So understanding what is it that's taking them away from patient care? Where are there redundancies that we can remove? How can we start to map out their experiences day to day so that we can understand how much time is spent administratively versus patient facing? And yes, we can go into the next question and I'm going to hand it to Brian, but before I do, just one other stat I would call out that's been really resonating with me. We ran a couple of those day-to-day sessions and found that 62% of a nurse manager's time is spent on administrative tasks each week. So the majority of their time is actually spent administratively versus delivering the care that they're really passionate about. So how do we think about helping to bring that percent down? as we move forward. All right, I'll hand it over to Brian to run this polling question and then go into near term.
Okay, thanks, Kendall. So polling question number 3, what is your organization currently doing in the short term to stabilize staffing? Increasing pay and compensation and benefits. I think we've got just a few more. Just a few more seconds. I think we've got a few more people finish answering their question. So it looks like for the majority, organizations have been looking at increased compensation or benefits, which aligns greatly with the information we've been hearing out in the community and nationally as well. I kind of thought that the traveling nurses would have been a little bit higher given some of the shortages that we've been seeing as well. So good information. All right, next slide. So like Kendall said, we're going to go through this and we're going to talk a little bit about the immediate fixes because at this point, health systems need to start pivoting fairly quickly to roll out other strategies that are going to help them attract and retain high quality talent and help stabilize in this near term. And we're going to kind of follow this similar theme. We're going to kind of talk about that satisfaction and burnout. Like Kendall mentioned, you know, the two are not mutually exclusive. They pretty much go hand in hand in the healthcare arena. It's no surprise the tremendous emotional and physical impact that COVID's had on not just the clinical staff, but all of our ancillary staff as well. And that's really prompted organizations to start looking at expansion access to EPA services. Some of the things we've been seeing out there are organizations providing those on-site interventions that are within the department to give staff an access and availability to people that they can talk with, get the support that they need. Some of the other things we've been seeing as well is, you know, creating private rooms, really giving staff the opportunity to step away from the departments, be able to find a place that's private, they can decompress, to really kind of shake off a lot of the day-to-day stressful things that they've been working through over the last 2 years. You know, there's also been mobile apps and then peer-to-peer support tools that have been implemented as well. When we talk about looking at the care models, you know, those have kind of run the gamut. As Kendall mentioned, it's really about looking at how we're going to right-size those staffing models that are really going to help clinicians be able to work at the top of their practice, optimize their clinical and ancillary resources so that health systems can maximize those resources and help increase the satisfaction as well. And it's no surprise that all the administrative tasks that have been layered on top of staff. We really thought with the implementation of the EMRs a decade ago was going to help streamline some of those efficiencies, and they've really put a lot of burden on staff. And what we're starting to see out there is a lot of new emerging technologies that are using AI and AR technology to help synthesize information, help assist with clinical decisions and improve patient outcomes. Some of the things like with machine learning, it's really helping kind of chart that patient's course and their plan of care, initiating and completing tasks automatically to help and schedule appointments or send results to care teams. So, you know, there's a lot of things going on to help streamline and make some of those efficiencies better for staff. When we talk about that onboarding piece, you know, like Kendall mentioned, I think she said in the first year, 20% of the staff are going to plan to leave. There was an article that I just recently read that some people even make that decision within the first 6 months based on their onboarding experience. And we know that that's a huge expense to organizations overall. One of the great ways for organizations to kind of rethink this is really showcasing the organization and the staff. You know, onboarding is not a one size fits all. There's a lot of models for successful programs, but what we're seeing is that having a structured collaborative process across the department lends itself to consistent methodology for your experienced staff and new grads. One of the clients that we have worked with in the past in Texas, they used walking rounds to help kind of connect with new and current staff that had just joined the organization. And technology is playing a huge piece in this onboarding process. It's a great enabler to help create more consistent onboarding processes. It gives a robust virtual experience that helps you create complete tasks through a portal, and allows staff to kind of navigate through that process. We're seeing tech platforms for training sessions, enterprise learning, and also even going to the point of doing virtual walkthroughs in the organizations and in departments that staff's going to work in. And there's one thing to consider, the virtual and tech piece is great for the millennials and the Gen Z. So organizations have to be mindful of taking more traditional methods into consideration as well. Also looking at those attrition rates, tracking those measures to see, why are the staff leaving, and what is it we need to kind of think about doing to retain those employees. Attrition rates give us just a glimpse, a snapshot into what's going on, but they really help us kind of retool and look for strategies that's going to help with that recruitment and retention process. And when you talk about the antiquated benefits and incentives, Kendall talked about kind of looking beyond what we do today and looking to tomorrow. We've got a multi-generational workforce. We're no longer able to rely on standard compensation and traditional benefits to keep employees happy. We have to kind of reimagine how we work and employees' reward packages. Some of the things we're seeing is, loan forgiveness for new grads that are coming out if they stay on board for a certain extended period of time. And career and personal development are some of the other incentives that we're seeing also. Next slide. We talk about those clear lines of communication. Taking steps to enhance communication and feedback through and with your entire team creates a better and safer work environment. Given those capabilities for communication transparency and communicating frequently with staff drives a better employee experience. Organizations are really tapping into that executive rounding piece, blocking off specific times during the day where different teams go out, touch base with the staff, gives greater visibility to the leader, gives that open communication between staff and leadership, and also leads to some robust staff engagement. It really allows them to kind of get a better understanding of what the experiences are like for the caregivers and help close any of those gaps. When we talk about, continuing education and the limited growth abilities, we need to really think about considerations of where staff are in their careers. New grads and young staff, they're going to be really anxious and eager to climb the ranks in the organization. And other staff, the seasoned ones, are going to be settled into their current roles and just kind of be thinking about, what they're doing today. But really, no matter where they are in the journey, that growth in education that they're looking for, they're really looking to develop those new tools, diversify their work and their experience. So when you think about the changes that have occurred in the workplace over the last 2 years, staff are operating in a marketplace where they are getting inundated with job offers through their inboxes and via text. So organizations that are using analytical solutions to predict retention trends and help correlate the factors help them explain why staff may be less engaged. And so lastly, when we think about the patient care and delivery models, it's not a new topic. We've talked about it when I was a clinician at the bedside. But the pandemic's really kind of forced us to relook at that. So, you think about the future of work is now, and our current environment is forcing us to change. We need to think about the better patient experience. We need to think about a better clinician experience. Organizations they're adopting IT infrastructure and analytical capabilities to track patient quality and cost outcomes. They can identify their high-risk patients and correlate referrals, care management, and direct at-risk patients to appropriate care setting and reduce unnecessary inpatient utilization. And using governance structures to help kind of define best practice for those units and departments. We know care delivery is not a one-size-fits-all. We're really looking to implement that test of change, and then look at the effectiveness and how we deliver that care. I did this once with an organization where we really started looking at that care model with different patient populations on their length of stay to see, what are the indicators that were keeping patients longer. And, it was a great way to adjust the care model, things that they were doing, and be able to, be more prepared in how we took care of patients and got them through the system process. And I think we might be ready for another polling question. So, how is your organization attracting and recruiting new talent? Just a few more seconds. I'm going to turn it over to Rosalind, and she's going to talk to you about long-term strategies.
Thanks, Brian. So I think we're going to return now to kind of those same themes, and we've kind of talked about what are the quick hits, what are the intermediate things, and then what are the longer term things that we need to do. So if you go to the next page, so definitely we're starting to recognize as organizations are coming up for air that this is not a quick fix. And while the near-term things are kind of helping us solve the immediate problems, we need to take a step back and look at the holistic needs to make sure that we are really growing this talent pool. And industries are competing against each other for critical talent. Healthcare talent has opportunity outside of caregiving in many cases. And so, with these kind of same areas, we'll talk now about the longer term focuses, right? So the whole notion of decreased clinician satisfaction and burnout, right? There needs to really use different insights to really make sure that we are making that experience for the clinician and caregiver as smooth and easy as possible. And also being able to use that technology to try to really get to a point of predictive analytics. So as we have a better body of data of what are the drivers of people leaving from a mix of, the patterns of age and tenure and department and, level in the organization and all different kinds of things, to try to really understand what are the factors that really would be predictive and have a model that is more predictive. The other piece too is kind of that longer look at workforce planning, and I saw some of the great kind of historic data that the Health Collaborative has been sharing for you. But in general, we see that need to kind of take a step back and almost convert that to a more proactive, forward-looking plan that really is going to look at what is the forecast for different key technicians, technologists, and areas, and then really start the process earlier. Think about all of the available talent pools and how is the sector going to really start the interest earlier to kind of lock in your unfair share of that talent. As mentioned earlier in the discussion, in a couple of the things, the joining of the organization is a very critical juncture as organizations are dealing with populations of the boomers that are retiring and needing to bring on that next generation of talent. And companies are really focusing on what is that full end-to-end experience, and how is that supported by kind of great process, great technology. And we've been accustomed through the pandemic. I mean, some of the silver linings, there have been many new uses of technology. Probably we were not all on regular calls like this before. The ability to just ask Alexa to do things for you, and much more automation and artificial intelligence built into things. New ways of learning, and really new ways of getting to know folks, with augmented reality and metaverse. So really kind of think about how can we incorporate some of those new forms of technology and experience. And the other piece too, just in terms of onboarding and kind of tied to the first one around pipeline, the notion of, can we really do better on the notion of internships to really try out folks and, give people the opportunity to, really make sure that they're a fit for the industry and getting to know the talent. The antiquated reward structure, Brian had talked about some of the various approaches, but, we're really seeing that kind of holistic portfolio look at the total employee experience, the total human experience around what are all of the programs that we provide in terms of compensation, in terms of the security benefits, so retirement structures and health insurance structures, and then the ability to take various forms of time off and leave, and how are those being used. And it's not just about the dollar amounts that are provided for that, but it's also around the broader experience and connecting also to the financial, social, emotional well-being, physical well-being, and make sure that all those areas are incorporated in a much more kind of end-to-end. And what companies have seen in sort of looking at some of that holistic experience is that they find that $1 of cash compensation. I saw a lot of the polling results. People are we always jump to kind of cash and especially to things around sign-on. Sometimes that's the first answer. And what we've seen is a mix of some of these other things, whether it's leaves for certain personal needs, whether it's parental benefits, whether it's caregiving support. I think Brian mentioned, the education and student loan support. So it's some of those kinds of things that actually has a much higher effect than, the single dollar investment that you might make in a sign-on bonus or in, putting some dollars into the merit. So, and definitely doing that with the kind of eye on the end user. So, the data in this space is more and more difficult. And at the end of the day, we need to make sure that we're listening to this talent pool and understanding what their perspectives are on, what will really make it most likely for them to stay versus other opportunities that they have. If you go to the next page, so a little bit more around communication and peer-to-peer support, and beyond the health crisis that we've all experienced, we've also all experienced, the various social crises and just challenges with our culture, and so some huge challenges, especially in the healthcare space, in terms of the caregivers and the requirements of the caregivers versus the non-caregivers. And making sure that our approaches to how we manage talent is really reflective of the diversity in our community, and that people feel connected to that. So, we've seen a lot of movement from just measuring kind of pure employee engagement, which is focused more on me as an individual. So, my pay, my benefits, would I stay? Would I leave? Do I feel motivated to invest discretionary effort? Really looking on, that culture that kind of goes to the team environment and more of the we, than just the me, right? And what are the behaviors that people are experiencing in work, and how do they feel connected to each other and to the overall employer as kind of a system, as being really critical. So trying to move beyond just understanding engagement to understanding the cultural drivers, and through that identifying what are the things about their culture that are great that they want to make sure to protect and advance through all different kinds of challenges like we've just experienced, and what are the things that they need to start doing or stop doing. So some things they need to leave behind, other things they really need to kind of reset the bar and start doing some different things. And, moving from this notion of, we had this huge big lift effort to do a once a year big all employee survey, to how do we really make sure that that's a much more robust and real-time measurement with technology. I mean, we've seen all the way to some really interesting things that companies are doing with wearable technology to measure both the level of brain immersion and the level of psychological safety that people are feeling. We talked a lot about, just changing skills and education requirements, and, companies are thinking about what are the balance of things that they can get outside, but what do they need to really own and curate and create platforms that are going to develop their talent in new ways, make sure that they have the skills. There are so many evolving both hard and soft skills that are needed in terms of how are you an emotionally connected leader, an inclusive leader, and being able to use data analytics and some of these new tools in how those apply in your setting. So, needing to make sure that you can both mix your own custom content and curated content to do that. And some of that is going to be, things that you can find outside. Others going to be in partnership with various universities and things. And finally, just, the whole notion of patient care and models of care delivery, really thinking about taking a step back of, what is the operating model for these roles? And then what is the best mix of the staffing mix to really optimize patient safety, as well as making sure that the clinicians have the support that they need. So I think we had one final poll on the next page, and then we will get to jump to everyone's Q&A. So if you think about the longer term issues around the Great Resignation and some of the challenges, how do you plan to think about talent retention from a longer term? Is it really around the financial incentives? Is it around making the job more feasible? Is it around flexibility? Is it around culture, or is it something else? Or, you can type in the chat, maybe, we just don't know yet. We're not sure about this. All right, so we're still seeing some polls come in right now. It seems to be that the leading choices are the restructuring of roles and responsibilities, and then also looks like a dead heat between retention bonuses and financial incentives, as well as a look at organizational cultures. Those seem to be the top three. All right, and with that, let me turn it back to Hope to share, to help us facilitate some Q&A here for the panel.
Great, thank you. Mark, I know you were also going to be helping with this part. So if you have some questions you'd like to start with, that'd be great.
Yeah, thank you, Hope. And there have been a couple questions posted. The first one is, where do we see employers connecting more and or differently with education as a strategy to increase their success in attracting and retaining new employees, I presume. Maybe Brian or Rosalind, if you want to maybe chime in, or if you have some thoughts.
Hey, Rosalind, I'll start off, and then I guess a couple of things. Hope mentioned earlier about, partnerships with schools, but one of the other big things we've been seeing out there is those nurse residency programs, and it's a really great feeder to get staff in during those final years, during their education, to allow them to experience the organization, find out where their fit is within the organization. I know that when I was in school, I worked in different departments, but I found my passion working in critical care. And so that's where I wound up. So that's a really good feeder. But one of the other things I found really interesting, and I'm sharing with the team, I did some analysis in upstate New York that some organizations are even tapping into their veterans programs. So looking at like workforce readiness for people that are coming out of the armed services. So they're starting to see, things like that be feeders and great opportunities to fill vacancies in organizations as well. Because a lot of veterans come out, they have a healthcare background, they've been EMTs, different things like that. So they have really a good skill set, working in emergency departments and things like that. So that we've kind of been seeing things like that as well.
I mean, the other, just to build on that a little bit, the other major kind of need that this starts to touch on as you think about kind of skills and building skills are, how do those skills connect to the job roles and levels and career paths? And, many times in healthcare, when you say, career frameworks or job family architecture, people start to panic because, they may have brought together different groups from different acquired practices or things. And unfortunately, there aren't necessarily standards of what do we call different levels and roles. And it makes it really difficult then to kind of manage the talent system and figure out what are the kind of skills and capabilities even that I have today versus what do I need in the future, right? So, one of kind of the foundational things that we see that's really helpful in all of this is sort of stepping back to say, what do I know about the talent pools that I have, and have I made the career path sort of clear in terms of the connection to that? The other interesting thing I've seen companies investing in that space is just really reconciling their approaches to what we do between the student loan forgiveness and the tuition reimbursement, because I think there's that question of are we treating people fairly who we had to buy the skills in the external market and got someone who took out loans and paid for the skills themselves versus doing it while they're working for us and had to get there through a tuition program. So thinking about how do they fund and support both of those ways of building out skills and making sure that they have enough coverage on both fronts.
Thank you. I know, Rosalind, you commented on this during your presentation, but maybe you could just elaborate a little more on how sustainable is it for health systems to provide increased benefit models for newly onboarded employees?
Yeah, it's a pretty interesting question, because if you would ask people about like how satisfied with you and what would you like more of, we would all say, I'm pretty dissatisfied with many things, and thank you, I would like more of everything, right? So I think the model of how companies need to go about that, has to be in the notion of like a set of choices, right? Because in essence, like we have a certain amount that we can afford to pay based on our reimbursements and based on what the market will support for certain roles. And so what companies find is that in certain cases, we might be over-investing in some areas and under-investing in others. So we might have, an 8% retirement plan contribution. We might have some kind of, fixed $500 year-end bonus that we just give everyone. So there are some investments that we might have just kind of across the board in peanut butter that we had as fixed allocations, and a question of how can we free up some of those dollars and reallocate them. So hopefully it's not a situation of, out of the gate that you want to necessarily pay more. I think what companies are critically looking at is how do I reallocate what I'm spending to make sure that it's the most efficient, so that for every existing dollar that I'm spending, and then looking at that through different segments of the workforce, right? So the newer employees, the mid-career employees, the different jobs and roles, and making sure that it's optimal and kind of understanding where are the pressure points and how can you invest.
Thank you. Thank you. Let's see. I'm just going through the questions here. So there's one, Hope, I think, or it's hard to, I don't know who's presenting it, but I think it's a good question. Just, maybe we could just quickly do a quick roundtable and say, what would be the one thing you'd like this audience to take away from us today, that they could take back to their respective organizations? Maybe I'll start with Kendall.
Yeah, I'm happy to. I'm going to kind of voice my opinion based on what I'm passionate about within the health industry and what I work with health systems on, and that's experience. So really making sure that what we are building and how we're looking at the problem is based on clinician experience. I think a lot of the ways that we've organized the systems previously are really from an organization perspective and not so much from the clinician perspective. So leveraging your frontline staff to understand what are the challenges today, and then building solutions that address their problems and not just the problems of organizations.
Thank you. Maybe Brian, do you have some thoughts on what's one thing you like the panelists to take away?
There's so many. I would think, kind of like Kendall was mentioning, I think really, the clinicians have a huge opportunity to kind of reevaluate the way they work. Given the last 2 years, I think just the models out there have been very antiquated over for quite a while. And so I just think, kind of looking at those care models, every department's different, how they kind of function, and kind of tackling things like that.
Okay, maybe Rosalind, any thoughts on one thing to take away?
I mean, what I would say is it's kind of like this three-legged stool, right? As we come up here and we plan for that, right? We have to really look at the workforce plan, right? Because we have to understand, is there a true supply gap where we just need to go back to the schools and the Department of Education and mint more people, because we have to understand how many people are retiring, how many people are leaving the industry, because at the end of the day, if we just poach talent from each other and there's really a net shortage in your geography, that has to be addressed. We need to listen to our employees more. So we need to understand what are the cultural dynamics that are going on and make sure that we address those behaviors. And it needs to be a safe and an inclusive environment. And then finally, the dollars that you're spending on your talent are huge, and you need to really look carefully and make sure that those are the right investments. So you have to make sure, is the shortage, foundational, and is a supply problem? Are you listening to your people, and is the culture working, and are you spending those dollars? It's not that you're not spending, significant dollars on these roles. It's, but there may be kind of misallocation of some dollars based on what people would really look for.
Thank you. And I may just chime in. I resonate with what you're saying, Rosalind. I really think of it as a balance between the supply and demand situation. So yes, we need more clinicians, and yes, we need to address the care models. I focus a lot of my attention on the care setting and where are those patients being cared for, and are we are in the habit of placing patients in the hospital where they might be able to be better treated at home with remote monitoring, and instead of having certain nurse ratios in the hospital, we have more better scheduled and a balance between those being seen in the home and in other ways. So I would say let's think outside the box, and it's not always add more staff, pay more money, but are we giving the care in the right setting to the right people and giving the right the right kind of care while they're there.
Thank you so much. And I cannot thank each of you enough for the valuable information you've shared. I have to agree, Rosalind, with one of your last comments. We need to be looking at net positive solutions. Simply poaching, just like simply hiring, is not a solution for what's going on with the current workforce crisis. So I thank you all for the great words of wisdom. If you want to go ahead, Lauren, to the next slide. We would love for this group to, for you to reach out if there's anything else that you wish to know from us. We also have our social channels for you if you're interested in connecting with us. And just again, to the audience, thank you so much for giving us an hour of your time to talk about this crucial issue. And we look forward to being your partner in solving for this. Have a great day.
Thank you, everyone.
Thank you.
Thanks.